You think about AEDs on a wall in our communities. Dispatch is a little bit aware of the location of those AEDs, those devices. However, what if those AEDs are hidden behind a locked door? Do people really know where they're located? Somebody is calling to say this person needs help, we need fire and EMS. When you don't bring 911 into the middle, then you don't necessarily have the ability to provide that connectivity. My name is Karen Marquez. I'm the Chief Public Safety Brand Officer for RapidSOS. I remember the early on days of the partnership when Samir and our team really started learning about each other and trying to understand what could Avive and RapidSOS really do together. And foundationally, the location of a 911 call is that information that is crucial for any kind of life save, regardless of what that emergency is. If we can't find you, we can't help you. And then you layer on top of that, new technology and innovation that is bringing caretakers, even in advance of EMS, to put those pads on a patient, provide that resuscitation, and really improve the out-of-hospital cardiac arrest. So it was really easy to believe in what Avive was doing, even in the early days, bridging the gap and bringing 911 into that workflow to ensure not only do they have the information that they need with the location of the caller, it's no longer this thing on a wall pointing somebody to go down a hall, turn right, grab something behind the door. It is, I'm going to give you pre-arrival instructions and I've already got something on the way. And now you're giving that reassurance as a telecommunicator to, yes, I have fire and EMS responding to you. Additionally, I have a care team member that is right around the corner and they're going to be knocking on your door in just a second. And I will get the chills right now because that is a powerful statement to know that as soon as you pick up the phone and ask for help, it's already on that way. That is bridging the gap between and bringing that connectivity to the care responder, but more importantly to that family member or friend or passerby that is wanting to help connect this patient to that care team. Regardless of where you are, where you work, live, play, and what you're doing in your life, you can now be connected to emergency services, have that technology not replace any of the humans that are in the middle of that, but actually superpower those humans with data that's layered on, passed through RapidSOS, out to the field responders and out to our 911 centers so that they know exactly what is coming in, what resources to send. When we're able to at least put a little bit of closure to families and provide a little bit of peace and comfort to them, the why is because there's a human in need. And it's going to take us all to get there to help them.